A systemic review of safety of topical corticosteroids in pregnancy was done by Cochrane, reviewing 7 studies. There is limited and inconclusive data to detect association between topical corticosteroid use and congenital abnormality, preterm delivery, or stillbirth. However, there does seem to be an association with very potent corticosteroid use and low birth weight, and one study did find an association as well with the use of topical corticosteroid in the first trimester and orofacial cleft. Therefore, administration of topical corticosteroids during pregnancy and lactation should only be considered if the expected benefit to the mother outweighs the risk to the fetus or the infant. The correct potency, minimum quantity should be used for the minimum duration. For patients which are lactating, the use of topical corticosteroids during lactation has not been established. During lactation, the aim is to prevent oral ingestion by the infant. If used during lactation, topical corticosteroids should not be applied to the breast to avoid accidental ingestion by the infant, or advice given that they should be washed off prior to breastfeeding or applied after breastfeeding. Another patient population we have to consider would be the elderly population. So in the geriatric population, they would usually have thin skin, which could lead to increased penetration. There may be pre-existing atrophy due to the intrinsic aging process. Some patients may also be diaper dependent, thus potentiation of the steroid may occur when this is applied in this diaper area. Skin atrophy can be induced by any topical corticosteroid through higher potency agents. Occlusion, use on thinner skin, and older patients' age increases this risk. Therefore, again, the minimum quantity should be used for the shortest duration to achieve the desired clinical benefit. And now we move on to the pediatric age group. The consideration that we have to make in the pediatric age group, especially in the neonates, is that there is an increased ratio of surface area to body weight, as much as 4 times to that compared to the adult. There is suboptimal epidermal barrier function due to the higher pH of the neonatal corneum being neutral instead of the normal acidic pH. There is decreased hepatic metabolism of drug. There may be decreased renal excretion. There could be an increased distribution of drug, including the CNS, due to more permeable blood-brain barrier, and there could also be decreased plasma protein binding. And always bear in mind that this is the group which wears diapers, which may lead to an occlusive effect. Thank you.